Please identify yourself.
Sure. Thank you, representatives. My name is Ellie Schilling, and I'm an attorney who represents reproductive health care providers in Louisiana. I'm also the co-founder of Lift Louisiana, which is an organization that provides policy and legal analysis on laws that affect reproductive health rights and justice. As you've just heard, the purpose of the bill is to require that all medication abortions be dispensed at a facility that is licensed as an outpatient abortion facility. So the purpose of the bill, all it does is to require the medication to be dispensed in a certain place. And current law is already more than adequate for protecting patient health and safety with regard to medication abortions. Under current law, medication abortions can only be dispensed from a physician who is enrolled in or completed a residency in obstetrics and gynecology or family medicine. The other restrictions, physician credentialing restrictions that the legislature has passed, such as admitting privileges, board certification, which both of those are blocked by federal courts, but those would also apply. So those physicians and their practice settings, like any other physicians, are regulated by the Louisiana State Board of Medical Examiners to ensure quality of care. As you've also already heard, almost none of this process occurs in a clinical setting. It occurs later after a patient has gone back to her home many hours and probably many miles away. So there's no medical benefit to requiring medication abortions be dispensed in a clinical setting, and even less so to impose licensing requirements on that clinical setting. Leading medical groups, including a 2018 expert panel convened by the National Academies of Science, Engineering, and Medicine, concluded that requiring medication abortion to be provided at a particular type of facility, solely by a physician, or in the physical presence of a healthcare provider yields no improvement in safety or quality of care. So the intent is simply to restrict access to abortion, which is particularly concerning with medication abortion because it only occurs in the earliest stages of pregnancy. The earlier a woman is able to obtain abortion, the lower the cost and the lower the risk of any complications. So if the goal of this body is to protect patient health and safety, you should be eliminating barriers to early access to abortion rather than increasing them. Other states are moving in that direction, such as by allowing medication abortion to be provided by telemedicine. It's also important to understand that the complication rate is very low. The complication rate with medication abortions is less than 2%, which is only slightly higher than first trimester surgical abortions, which are 1.3% complication rate. That slight difference is because in the majority of complications having to do with medication abortion are when so essentially the medication, it induces a miscarriage. And as with a spontaneous miscarriage, that process can be incomplete. And you have to go to a doctor, either the hospital or the clinic, to have a D&C. So whether you got the medication from a licensed facility to begin with does not help in terms of patient health and safety. If that rare complication occurs, you just have to go back to a medical provider. So the purpose and the effect of this bill is to drastically reduce the number of places where it is legal to obtain an abortion. There are only 3 licensed clinics in Louisiana today. Regulatory burden and other restrictions have caused clinics to close, and as many of you know, a new license has not been granted to a facility in many years. Limiting access to medication abortion to 3 locations in the state is not medically necessary and creates an undue burden on women seeking abortion services. Thank you for your time, and I'm happy to answer any questions.
Well, we do have one question from Representative LeBeau.
Thank you, Mr. Acting Chair. Yes, ma'am. First of all, and I appreciate your testimony, myself and other Louisiana citizens consider the fetus a Louisiana citizen. Our responsibility is to protect the citizens of this state. So anything we can do, or I can do, to protect that, although it's a minor thing, to make them go to the right place to get their medications, should be done. 2% complications, if it's me that's in the 2%, it's serious. Anybody in the 2%, it's serious for the life of the mother and the mental stability. I think it's absurd to say that it's a good way to do things. Anytime you're taking someone's life, it's not a good way. Thank you.
My response is I understand your position, and I understand that that's the position of some others in Louisiana. And my concern, of course, is about taking away women's constitutional rights. And when you restrict access in a significant manner, which this bill will do, then it creates constitutional concerns and it creates increased litigation for the state.
I guess that's one for the courts of law, but I consider the fetus a citizen, and it has constitutional rights also.
There's no further questions. We do have here in opposition but do not want to speak, Linda Hawkins, League of Women Voters, Mandy Landry, Lift Louisiana, Michelle Ehrenberg, Lift Louisiana, Jessica Fresnel, and Ann Steer with National Association of Social Workers are all in opposition. There's no more questions.
Linda Hawkins, if you will come forward, please. Louisiana League of Women Voters. Also, Ellie Schilling. You'll come forward, Ms. Schilling. We have 4 other cards in opposition but not wishing to speak. Jessica Fanhill, Michelle Ehrenberg, Media Landry, and Ann Steyer. Yes, ma'am.
Good afternoon. My name is Linda Hawkins. I'm with the League of Women Voters of Louisiana. I am the Healthcare Program Chair. I also have specific knowledge on healthcare records. I've been the custodian of records for large VA hospitals, a Privacy Act officer, and a Freedom of Information officer. So I have had a long history in medical records. I would like to talk with you. I know you do have some new members, and I know I'm time limited, so I will speak very fast. The mission of the League of Women Voters is a political organization. We're encouraged in informed and active participation. We work to increase an understanding of major public policy issues that influences public policy through education and advocacy. We've been around since 1920. We got the right to vote for women. We're a part of that and came into Louisiana in the 1940s, so we've been around a while. Now, as the League of Women Voters position in health care, we measure all of the policies when we start looking at it as a basic level of quality health care at affordable cost should be available to all Louisiana citizens, including behavioral costs, using effective and economical cost control mechanisms, tools, and techniques. Representative Cruz 480 bill, as I understand it, is only focusing on abortion clinics, health clinics. My concern in this whole bill, and I'll go through it really quickly, it does not support efficient and economical approach to quality health care. It's costly, it's ineffective, unaffordable, and it's a state overreach. It's fiscally unsound with increased health care cost. It appears discriminatory on its face. Why? Because it targets and singles out businesses for women's health issues only. The bill ignores and fails to include other bill entities such as hospitals, freestanding clinics, private entities, prisons. They also provide women's health care, and they also should be followed in this bill if, in fact, that is the intent of the bill. It is bureaucratically burdensome and does not identify how and who on an ongoing measure will monitor all of this. Reviews. Yes, after the fact, you find out about it, just like Representative Cruz said. But who's going to do the on-term monitoring daily? Who's going to pay for that? The bill itself, to me, does not cover what is needed. The bill's stated concerns are not covered in what is happening. He has not identified private and public entities that need to be covered. The cost-benefit analysis was not done, and it's going to affect the businesses. Guess what? Businesses. These are businesses. Suspected criminal law and enforcement issues should be applied equitably across all healthcare entities, regardless of the nature of the business, not just abortion businesses. In your hospitals, in your boutique clinics, in your surgery centers, if that's what you're going after, and if in fact it is about trying to preserve and protect people, it needs to go equitably across the board. We ask the committee members to oppose the bill for the stated reasons under the HIPAA, as well as was stated earlier. Yes, the HIPAA regulations, regulations say 7 years. The state can go ahead and impose more if it's appropriate. However, the entities that must be administrative, technical, and physical safeguards to protect the privacy of medical records, contents, and protect the information for whatever period, including through disposal. So the folks that did do this and disposed of records unlawfully, they need to be held accountable. Absolutely. But don't single out women's health care services. Across the board, I ask you to expand the bill if that is the concern. Otherwise, the way the bill is written does not seem to be focused on the issue or the intent. Thank you very much for your time.
Yes, ma'am.
Thank you, representatives. I'd like to be clear first about some of the facts that were stated in terms of the closure of the Bossier Clinic. The owner was very clear, this is probably the affidavit that you have, this is a public record, that the reason that he had shredded the records after the clinic closed is that he was very worried about patient confidentiality concerns. Not only had he moved to another state, he had no business operations at all in Louisiana, no employees, there was no one around. Just keeping records somewhere endlessly creates patient confidentiality concerns. This bill would require clinics to keep records for 30 years if there's any issue suspected that would have created a mandatory reporting or that anything about the patient was reported to law enforcement for 30 years. For minors, it's 10 years after the minor turns 18. So we're talking about having these records for a really long time. And how then are you going to be able to ensure that patient confidentiality is protected? There's other problems with the bill too, in terms of its stated intent about trying to I know it's late. That's all I have for today. Any questions? I would be happy to answer them.
There are no questions. Thank you, though. Representative Cruz, you want to close?